The 2018 Rural Ontario Municipal Association Conference ran Sunday through Tuesday in Toronto. Back on Saturday, DSAB, the District of Nipissing Social Services Administration Board, issued a press release which featured the headline, "Community Crisis, Alarming Primary Care and Community Mental Health Needs." The timing of this release, not a coincidence.
It was planned that way, to bring attention to what's happening in the district and actually inside the city of North Bay with respect to those issues of mental health and substance abuse. It's, in my mind, is rampant, and certainly we wanted to bring that message to the provincial government.
The headline of Roma for DSAB, a meeting with Minister of Health and Long-Term Care, Eric Hoskins.
My general feel, in meeting with the Minister of Health, certainly he was very engaged in the process. He gets it. He knows what's going on. I found him extremely receptive to the point where he gave instructions to his staff in front of us at the meeting about how to proceed forward in the whole process.
The most important message to convey to Minister Hoskins, the fact that 30% of the Nipissing district is not attached to a doctor.
We know that the opioid use, the drug use in our area is way above the provincial averages. So basically it's an opportunity to make sure this community gets the supports it needs.
Now, money doesn't fix everything, but it certainly helps. Is money on the way from the province to help with these issues?
Well, we're hoping that by having some attention on this particular issue, that the province recognizes the situation that's unique in this area, in particular the number of individuals that are not being served, but also recognizing the challenges with the drug and alcohol and mental health issues that are within this region.
These issues not exclusive to the Nipissing district.
We know that in Northern Ontario, the marginalized groups here in the north, there's a significantly higher portion than Southern Ontario. But we also know with health equity and social determinants of health, there are challenges in this community with making sure that we have equitable services versus those that are in Southern Ontario.
There is a sense of urgency within DSAB.
The longer you are without a doctor, the more complex the case becomes. And the more complex the case becomes, generally the shorter life expectancy is for those individuals in the north. And this is why it's absolutely imperative that we demand these equitable services.